Welcome to Mad Medicine with Miss P. Don't worry, I haven't gone goth. My lipstick's just a little dark. It looks darker in here than it really is. I'm wearing brown today, so it matches at any rate. Couple quick things because I've got to get out of here, and I am barely holding it together right now. I can't even tell you the world of hell I've got happening, but it's going to be fine. Everything is going to be. One day I'm going to come on here and say everything is great, and I can't wait. All right, I'm going to try to do this real quickly because I gotta get going. Just a couple quick things. When patients are giving me their medications, they say, okay, my morning meds are this and this and this and this. And then they go to their night meds, and often it's the same one. So instead of saying metoprolol 50 milligrams twice a day, they give me their morning meds and then their night meds, and they're all the same thing. It's just twice a day. So I have to go back there and fix it. I don't know why they do that, but God, I'd love to give a little lesson in how to give medical information. Oh, this one patient said, there's that box that says, have you ever seen a cardiologist? If so, what for? And, when and what's going on? He writes in, yes, 2002. So 21 years ago, just the one time. And why? He wrote in the word sibling. Do you think he meant like his brother's a cardiologist and he went to visit him? Sibling. I don't know what that means. Okay. And then, oh yeah, this kind of made me laugh. This one sweet little lady, she answered all of the boxes, filled in all the boxes, except she left one box blank, and it was for memory loss, and it's a yes or no. And she left it blank. I guess she forgot. That's my dad joke for the day. She forgot to mark if she had memory loss. That's good stuff. One of my all-time favorites is in the box. They say, keep me alive. Good tip. All right. Okay. And that's the box where we say, what can we do to make your stay better? And keeping them alive would make their stay better. And that's okay. We can do that. Under surgery, they wrote rhinoplasty, and they think they did that under local, which of course they don't know what that means. I really wanted to get rid of that. One lady under surgery, she told me, I was getting this information over the phone, and she said she had an ablation. I said, okay, what part of your body? We can ablate anything. And she said, vaginal. I don't think we do vaginal ablations. Maybe in some other countries where women don't have rights, they may do that, but we don't do that here in America. I said, do you mean uterine? She's like, oh yeah, I guess so. Okay. And here's the thing. If your spouse or your daughter or anybody is a doctor, I would not tell your medical crew that, because we will not treat you any differently. I don't even understand what that means when y'all say that. Yes, my daughter is coming to pick me up, Dr. Mary Smith. Okay, can she drive? If she can drive and read, that's really all we need. We just need her to drive and understand the post-op instructions. It really doesn't matter if she's a doctor. Or when someone says like, yes, my husband's coming to pick me, Dr. Barry Farber. Okay, as long as he can drive. I don't know why you would think that we're going to refer to him as doctor. He could have a PhD for all we know. I don't care what his education is. He just needs to be able to drive and preferably, communicate with us. Oh yeah, I heard my my coworker, this patient is telling her that she's never had a colonoscopy because she had a test for it. She had a test to see if she had colonoscopy. They tested for it. The good news is she doesn't have colonoscopy because she had a test for it. I got nothing. Oh, a patient said that he's allergic to antibacterial soap because he almost died. Death by dial. Death by Lever 2000. I don't know. Death by antibacterial soap. I kind of want to see that. I'm not suggesting I want it to happen. I just want to watch the guy bathe himself in soap and see if he goes into anaphylaxis. Probably not. Probably don't want to watch him bathe either. The back surgery. They had a spinal infusion. We infused their back. What fluid do you suppose you would infuse into a spine? Any ideas? Me either. In that box. God, I want to get rid of that box. It says, use the best anesthesia you can. The best drugs you've got, use them. Those crappy drugs that don't do anything, don't use those on me. Use the best anesthesia you can. All right. This lady also thinks she had a stapesectomy. You know, they remove your stapes. Stapesectomy. Took your stapes out. I don't know what that is. Also, the medication a patient told me they were on. Now, I've seen this many a ways. Usually they just put A in it, but this patient is maybe taking the lead man at a construction site because she takes metformin. That's what she's taking. Metformin. All right. I hope it's working for you. Keeping that blood sugar intact with your metformin. And then also, here's a little combo drug, cyclobenzapril. It's a muscle relaxer and an ACE inhibitor. Cyclobenzapril. Write that one down. Yes. My coworker talked to a patient who had that flesh-eating bacteria, necrotizing fasciitis. Okay, well, how was it treated? Did you have surgery? Oh, no, it cleared up on its own. Oh, well, that's new. Necrotizing fasciitis cleared up on its own, didn't require any bacteria, no biotics, nothing, just cleared up on its own. That is very fortunate. Yeah, and then when you're giving me your meds, I know I've said this in the past, could you not give me a pharmacology lesson as you're telling me which medication is for what? Because not only are you always wrong, like painfully wrong, it wastes so much time. Just tell me the name of the med, the dose, the route, the frequency. That's all I need to know. I don't need to know any backstory behind it. None of that is necessary. Just the med, the dose, the route, the frequency. Because when you see that little timer on your phone, click to 52 minutes. That's the same phone call for 52 minutes. I don't know how to get out of that. You can't withdraw from that phone call. There's only so many ways you could rein them back in and get them back on track. It's 52 minutes. That's a really long time to talk to one person in circles about their medication. Oh, yeah. And here's the other thing with the whole diabetes. Now, I've explained this so many times. I don't understand. I think we even talked about this last time. I know I took a little 2-week hiatus there, but I needed that amount of time to recoup. Okay, so you know that scene in Con Air where Nick Cage's little partner, that little black guy with the diabetes, he's totally normal, totally with it, and then he starts this like weird shaking thing, and he's like, I need my medication. Now keep in mind, they are on this flight, have been for hours, it seems, during the length of the movie, and suddenly his sugar spikes. He hasn't eaten a thing. I don't know how long before his previous meal was, but suddenly, hours later, they think he needs insulin. So that's when Nick Cage is like, quick, we got to get to underneath the airplane to get his insulin, because that's where you keep insulin. In the refrigerator underneath the airplane, I guess. I don't know. So they're rushing to get him his insulin. Okay, let me tell you why that's not a thing. If he so badly needed insulin, first of all, you can't just give him the shot, like in terms of endearments, where she runs up and down the hallway and she says, give my daughter the shot because her daughter's in excruciating pain. Completely different story. She needed the shot. When we talk about insulin and give me the shot, that's not how that works at all. Especially if they're under the impression that his sugar is so high that he immediately needs this insulin, even though he hasn't eaten for hours. And who knows, what he ate then, but you have to check the blood sugar first. And not only do the producers of Con Air not understand that, diabetics don't understand that either. I don't know why. It seems to me like if you're an insulin-dependent diabetic and you've been diabetic for years, you understand that if you're not eating, your sugar can't spike. It can go a little bit higher depending on your sympathetic nervous system and how nervous you are and kind of how that whole process works. But it's unlikely that it would spike so high that you immediately need insulin. And if you have an insulin pump and you're getting ready to have surgery, you don't need to do anything to it. Stop asking what you should do to it. That is your internal synthetic pancreas. Leave it alone. It's going to determine what your sugar is and decide how much to give throughout there. Until you eat, it's not going to suddenly bolus you insulin unless it's set that way, in which case, yeah, don't set it like that. I don't know. I've never had a pump. I don't know anything about it. They're internal. I don't even know. I'm sure you do it with your phone or some other kind of device, but it worries me when someone is in their 60s or even 70s and they don't understand how insulin works and they've been diabetic for years. It seems to me that that should be something you should spend some of that retired time looking into and understanding and learning about it. I can't figure it out. But at any rate, okay. Oh yes, under allergies, this patient wrote nasal. They're allergic to nasal. I don't know what that is. Okay. Oh, and this one patient takes 4 liters per minute of oxygen for no reason. Quote, end quote. No reason. I just do it. All right, that's a good idea. Oh, and another patient, their allergic reaction, and I can't even remember what the medication was because it really doesn't matter. They get a flesh-eating rash. Just process that for a minute. A flesh-eating rash. I don't know what type of organism is a rash that could eat your flesh, but they are creative, and that's the important thing. Oh, this patient says they're allergic to losartan because when they're on losartan, they're allergic to the sun. I don't know what any of that means. All right. This other patient thinks they're on telmisartan. I'm assuming they meant telmisartan, but I still have to type as they're saying ridiculous things. And like I said before, if you start typing and all of these drugs come up and then you continue typing and then they all go away, that means you're inventing a medication. So back up and then read the choices. Read the 50 choices they have there and pick one of those that are an actual medication instead of inventing one. That would be so helpful for us. Okay. Oh, and this happens all the time. We call, or even the patient's family calls back and they're like, well, I'm Mr. Smith's wife. Can I help you? No, not unless you're Mr. Smith. So no. Okay, well, he's not here right now. Can I take a message? Yeah, okay. This is so-and-so and I'm, the phone number is, and well, hold on, let me get a pen. If you're going to ask to take a message, could you be prepared to take that message? And it happens every time, not once or twice, every time. I call for somebody, they're not here right now. Okay, can I take a message? Sure. And then before I can say anything, they say, like, be Monica, just have the pen and paper by the phone. You don't ever have to wonder or worry. Yeah, so if you think you're allergic to penicillin because it's family medications, that is not an answer of what happens to you when you take penicillin. Family medications, that's not a, and if you think you take 20 milliliters of Ozempic, I'm pretty sure that would kill you. There's no subcutaneous fluid that is 20 milliliters. I can't even imagine what that, I mean, we can do an infusion and that would almost be one. But most of them are like 1 milliliter. So I don't know Ozempic enough to know how much 20 milliliters of Ozempic is, because usually they start you at like 0.25 and then 0.5 and then they'll go to 0.75. Then eventually I think one milligram is the most. So I'm pretty sure 20 milliliters is maybe your entire 6-month dose. I don't know. That's not a thing though. Oh, Seclot. She's allergic to Seclot. Ceclot, Seclot. And she was rad as a baby. That's what happened when she took Seclot. She was rad as a baby. If you're wondering if this woman is Klingon, I believe she is, because I don't know any of those words. They're not things. So I don't, yeah. And then this one really makes me want to just jump right through the computer and throat punch this guy. Why did you see your cardiologist? And he wrote on for a visit. I'm not kidding. For a visit. That's why he saw his cardiologist, for a visit. How I wish I was joking. That's a real thing. You understand that when we ask why you're seeing your cardiologist, we already know it's cardiac related, so you don't need to say for my heart or anything like that. Your response is a disease process. So you have CAD, because then I can see in your surgical history you've had stents, uh, bypass, anything like that. Then I can clearly see that. It's pretty obvious, but um, for a visit is why you go to visit anybody, is a visit. That's what is called, a doctor's visit. So I don't know if that's passive aggressive or just plain dumb, but at any rate, okay, I got to get out of here. Face your fears, forget your failures, follow your faith. I love you.